వెనక్కి రాబాకు. ఈ వెనక్కి రాబాకు. శశి
Dr. Shashidhar? Dr. K. Shashidhar?
Sir, వస్తున్నారు సార్, ఒక్క నిమిషం.
Just start the event.
350కి దగ్గరకు వచ్చేసింది కదా, మొదలు పెడదాం.
ఓకే.
శశిని ఇన్వైట్ చేయమని. అభిరామ్ షీట్
పైన కూర్చున్నాం. బయో
Good morning to everyone who are presented here. Greetings to all of you. I am Dr. K. Shashidhar, Founder Secretary, Center for Environmental Education and Ecological Development, and Organizing Secretary of the today's webinar. On behalf of the organizing committee, I welcome all of you to today's national webinar on biomedical waste impact on health and environmental during pandemic times. I would like to thank all the registered participants who are participating in this webinar, and I would also like to express our gratitude to our esteemed resource persons for accepting our invitation and giving their valuable keynote speeches on today's topic. We are very happy with the huge response from all over the country. Nearly 1,200 participants are registered to this webinar from 21 states. I would like to express my sincere thanks to all the registered participants who gave their immense support and encouragement from the starting of our journey in conducting webinars in the pandemic times. With this support and encouragement, we made sure to continue conducting seminars and webinars on important environmental topics with the same spirit. It is a small announcement to the participants. Dear participants, please enter your correct email ID in the feedback forms to get your certificate. The technical part of the feedback form is an auto-generated process. Manual corrections cannot be made, so make sure you enter your correct email ID in the feedback forms. Otherwise, you won't get your certificates. This feedback form can generate 1,400 certificates in a day. Now we have 1,200 participants. So everyone will get their certificates with no. We will post the feedback forms in the chat box at the end of the webinar. The other announcement is that if anyone wanted to ask questions to the resource person, please post your questions in the chat box. Our team members will ask the questions on behalf of you. So please put your questions and queries in the chat box only. With these few opening remarks, I will conclude my welcome message, and now I would like to invite Dr. A.V.V.S. Swami Garu, Founder Director of the Center for Environmental Education and Ecological Development, and also Director of the webinar, to take charge and conduct further proceedings of the webinar. Thank you one and all, and thank you very much. Over to Swami sir.
So, welcome, Professor Ghosh Garu, Vijay Kumar Garu, all the delegates, interested people. So we are very fortunate to have people of international repute to address us today. And that way, I feel I should thank the what we call the COVID-19, because through webinars we could meet so many eminent persons. Otherwise, they could not spend the time to all the way come to Guntur and deliver lectures. So, in that direction, I want to thank COVID-19. And the theme of today's webinar is the COVID-19 biomedical waste, which is generally not covered in the gross themes of webinars. But without this biomedical waste hand management, the whole India now must have been converted into a dump yard. So each one individual is nowadays raising about few grams. Otherwise, it is the biomedical waste is only generated in the healthcare establishments, and the patients, long-term patients with debilitating diseases and all, which is neglected. Say, for example, throughout India since 1915, if you just look at the statistics given by the Central Pollution Control Board, the whole India is generating about 100 tons per year. So for the last 4 or 5 years, like 1950, 2015 to 2018, if you take, it is 507, 526, 548, like that. It is roaming around 500 tons per year. But with the advent of what we call the COVID-19, the almost 100 crore population is now made to wear the what we call the masks, and at least we are daily looking at the figures of people who are joining the hospitals, attending the quarantines and all these things put together. Now the biomedical waste generation has become multifold. So out of the 230,000 healthcare establishments, that means hospitals, only 87,000 hospitals have the bedded facility. So dominantly, all district headquarters will have the government hospitals with a certain, at least a minimum of 100 beds. And the corporate hospitals, so I need not name them, but all they have good number of 220, 250,000, depending on the group of strength of that group of these thing hospitals, group of hospitals. So like that, we have 87,500 hospitals are only bedded hospitals. Remaining things are just like OP management, like that. So with the sudden abrupt eruption of what, like a volcano, the COVID-19 has erupted like anything and made every citizen of India as a patient. The non-medical assistance, with the non-medical assistance, but you are supposed to wear the mask. Nowadays, from the last 1 month, we are made to use 2 masks with an N95 and another one for this surgical mask. So like that, the garbage generated or the waste material that is generated from the healthcare establishments has been continuously increasing, and it is now for the last 1 year, it reached its peak. We never expected this kind of spurt in the growth of hospital hospital wastes. So even without being a patient, you are made to generate healthcare facility wastes. And to meet all the handling facilities, we have surprisingly only 200 healthcare facilities, healthcare establishment like what we call the biomedical waste handling plants. We have only 198 permitted so far throughout India as per the Central Pollution Control Board. We CPCB is to give the license for this. So covering districts at district levels, each one is Andhra Pradesh such a way it is better ranked to have sufficient number of the biomedical waste handling plants. So this sudden spurt of handling this much of things, do we have the capacity? First question. And if not, what is the options left with you? So since 1999, when we formulated the rules for hospital waste management, so only after 2006, the rules are perfectly implemented and now in a better state of implementation. But the individuals cannot practically, what we have seen, we have been observing is the generation. Say, I tell you one example, it's not out of this one, out of situation. Now, along my walking track every day, we have 2 corporate hospitals and 1 general hospital. General hospitals. So earlier we used to see at morning 6 o'clock, few autos, 2-3 autos used to come and pick up all the wastes. Now, at least 3 tractors are coming to pick up all this waste that stored in the garbage covers and all properly. And just like the rice load, paddy load in the tractor, which rises above the body. So such 3 tractors are collecting these wastes every day. It was a surprise to me. So like this, in this pandemic situation, so almost every country is facing this kind of thing. And what we have the processes with us is only the pasture, incineration, pulverization, like that. So many few things are there. I mean, sterilization and supplying. And in the rural areas, remote places also we have deep burial practice, but which is not safe with the COVID. Earlier, the deep burial is permitted in the remote places, but in the COVID times, it is not permitted. So under these situations, our government also is putting maximum efforts, and despite that, awareness among the people. Say nowadays we are using 2 masks per day, throwing. Generally, it goes to 98% of it will go to the solid waste dump sites.
Okay, sir.
But there are scientific methods for disposal of this waste, and it has, if you ignore, it has a certain very long-term impacts like groundwater contamination and so many things, in which few minutes after you will be knowing all these things. So with this few introduction, I tell you a few words about the CEED, Center for Environmental Education and Ecological Development. Any policy keeps in mind 2 things. One is how to make awareness, bring awareness among the public about this policy, and the other one is how to make develop the essential facilities for all these things. So in order to So because we are all employees related to environment and working with various organizations like PCB, Mineral Development Corporation, and all these things, we started a program through this CEED to generate awareness among the public. To going to as much as remote as possible, taking up so many 10 to 15 programs every year, and involving many people, and sometimes we are also planning, if once this COVID situation is subsides, we want to give training to the lecturers, voluntary organizations, and in a phased manner. We want to realize the objectives of this CEED. And with this brief introduction about this thing, I call one more speaker who is now running an organization called PRAKRUTHI, Nature, in an engineering college near to Vijayawada. And I invite Dr. Nilofer to present about her PRAKRUTHI. PRAKRUTHI, just take 2-3 minutes only. Nilofer?
Yes, sir. Good morning to one and all. I'm Dr. Nilofer, working as Assistant Professor in Lakireddy College of Engineering. I would like to welcome all the participants to Biomedical Waste Management Impact on Health and Environment in Pandemic Times. I would like to thank Dr. Swami sir to give me this opportunity to collaborate and work with CEED and Acharya Nagarjuna University to spread such valuable and useful programs, awareness programs. On this occasion, I would like to give a brief, very brief introduction about our PRAKRUTHI Club, which is working to strive towards spreading environmental awareness in and around the college. PRAKRUTHI, the Environmental Club of LBRC, has taken its birth on 18th June of 2018. With a goal to increase and promote awareness of environmental issues such as protection, conservation, preservation, restoration, and help students and staff to adapt the idea of philosophy of sustainable development in their daily lives at college, and out of it, with an emphasis on educating and empowering them. PRAKRUTHI is a voluntary group comprising of students primarily with an aim to create awareness within the college. We have initiated so many programs which included spreading awareness through national national webinars, and also small initiatives like banning plastic in our college and increasing the use of recyclable products. And we have also initiated the use of paper bags and avoided all the polythene bags. We have encouraged students to increase use of these recyclable items. We have initiated a small medicinal herb garden in our college, and we are increasing the number of medicinal herbs in our campus. Our principal sir, Dr. Acharya sir, has initiated this program, and we are also educating the villages and the students outside our campus, students from various schools and colleges, to increase awareness in these programs and to participate in such programs. With this small introduction, I would like to thank Swami sir, and I would like to hand it over to Swami sir. Thank you, sir.
Okay, ma, thank you for your brief presentation and restricting to the time which is given to you. And I now invite Dr. Brahmaji Rao for some more opening remarks, and also what he felt is a privileged thing to introduce the very eminent, practically, I say, a practical man, practical gigantic works he carries out, and is a network in 26 countries nearly, and organizes every year international seminars. And we are also fortunate to have one seminar with him, international seminar with him, in which about 800 participants have visited the Nagarjuna University for this international seminar on solid waste management. And the person is nothing but Sadhan K. Ghosh, And now Dr. Brahmaji will speak a few opening remarks about this webinar, as well as take this privilege of introducing Professor Ghosh to the audience. Now, Dr.
Okay, good.
Brahmaji Rao.
Okay, thank you, Dr. Swami. I am very happy and a warm welcome to the national webinar on biomedical waste impact during COVID-19 or pandemic times. The theme is a very specific. Already we have the biomedical waste management rules, and also we have the biomedical waste segregation, disposal and treatment facilities also available. But during the pandemic times, the COVID infected people, how they are taking care and disposal of waste from the isolated wards, hospitals, and at the same time home isolation. They are using the different kinds of materials. Generally, the biomedical waste is generated from household to the isolation wards to the hospitals also. So the segregation is feasible in sometimes, but the segregation is not feasible in sometimes. Anyhow, they are giving a cytotoxicity, and at the same time, infections are spreading through the disposal of the masks or disposal of the used material in the biological sense. So they are giving a very problematic to the community. So this community level infected diseases, how to manage, that can be taken care by the Central Pollution Control Board is also given a certain rules to maintain the biomedical waste during COVID-19 time. And at the same time, the biomedical waste management rules 2016 is available, and afterwards amended 2018 and 2019. And at the same time, infection prevention and control, that is 2020 is also given specifically COVID time. The rules are modified, and average COVID-19 biomedical waste is generated. That is calculated by the CPCB during May 10th. That is 2,003 tons per day, not per year. 203 tons per day is generating from in India. So like that way, the biomedical waste generated during COVID-19 situation, we are very much cautious and taking precautions, as well as giving the awareness and awakening to the public to develop the what is happening if you are not supposed to dispose in a proper manner. If anybody disposes, what we are supposed to take a precaution, that is a very much essential. And some of the live examples is also giving by everyone to take much impact during the COVID-19 situation. In the first wave, we have seen you are not at all go nearer to the COVID patient. And the second wave, we have somewhat considerations, but how to take a precaution measures if the COVID-19 patient is also nearer to me. Like that way, any kind of discarded biomedical waste during the COVID-19 from the household isolation centers, hospitals, and other centers, we are taking a much impact on environment and health issues also. And so we are specifically giving these two issues, that is the health issues as well as the environmental issues related to the discarded COVID-19 hospital waste management in and around of the country. And at the same time, I am warm welcome to all the participants. Doctors are involved, professors are involved, and research scholars, students.
Welcome, and say welcome to Dr. Reddy also. Professor Reddy from Andhra University also joined us. So
Professor Reddy from Andhra University, Maruti from Krishna University, Kirti from Nannaya University, and so many other states. The teachers are also joined in this webinar. I am very happy to interact with all the participants through this webinar, and I hope this is one of the present situation scenario what we are about to take. That's why we are selected the two resource persons. The first one is the Professor Sadhan Kumar Ghosh from Jadavpur University, and the second one is the Dr. Vijay Kumar from Delhi University. So concerned as well as related to the specific subject as well as a specific topic. So now I am introducing Professor Sadhan Kumar Ghosh garu, who was the icon for the solid waste management rules. Generally, the icon is every year Professor Sadhan Kumar Ghosh is conducting the international conference on solid waste management related to the specific topic that is relevant to the UN declared problems or UN declared or UN identified threatening problems. And solid waste management is not only a specific management, he was also developed the circular economy. Importance of the circular economy in our scenario, that is also very specifically he was mentioned. So Professor Sadhan Kumar Ghosh, President for International Society for Waste Management, Air and Water, and also IPLA Global Secretary, and Professor Jadavpur University. He served as the Dean Faculty of Engineering and Technology at Jadavpur University, Director of the CBW at the Ministry of Labor and Employment, Government of India. And Professor Sadhan Ghosh is internationally known for his research on waste management and green manufacturing, having more than 250 publications, and principal investigator for 35 projects, both national and international. So he was the one of the prime source for anyone those who want to send the project proposals. He was giving the suggestions for funding also. So international reputation is given by the Sadhan Kumar Ghosh, and actually significant contribution is the collaborative research with the experts from more than 40 countries on circular economy. And he was the 3R promotion programs. 3Rs means reduce, reuse, and recirculate. That is the main that how we are going to develop that 3R concept is awareness is given. He is involved in policy making committees, standard development and circular economy in small and medium sized enterprises. He is the founder president of the Society for Waste Management, Air and Water. So that Sadhan Kumar Ghosh is one of the repeated, and every year he was definitely organizing this icon, that is icon SWM 2020 and 2021 is also organized. He was planning this year in our state. He was supposed to be organized in SV University. Now I am invite great personality and expert resource person related to the biomedical waste as well as the solid waste as well as the medical waste. Now I am inviting Professor Sadhan Kumar Ghosh garu to interact all the participants. I am welcoming to the national webinar. Welcome, sir.
Thank you. Namaskar. Professor Swabi, my very best friend, and Dr. Brahmaji, my very best friend. And I can see some of my friends in Andhra Pradesh from different universities. So it's my real pleasure to be in this gathering and to learn more from the students and also the professors, the faculty members who are here on different aspects. And I'm very happy and I'm congratulating the whole team led by Professor Samiji and Ramaji, that as of now I can see 459 participants who are present in this webinar.
So now YouTube link also is open, sir. Some of the
Facebook
delegates
and
are looking at
live
that.
streaming.
Yes.
Yeah. So that's great. So this shows that the endeavor taken by them is really appreciable and a successful event. So I once again congratulate both of you and your team members. Just I'll take 1 or 2 minutes time regarding the involvement of ANU. As Professor Swami was telling that 2018, we had around 837 delegates from 23 countries who accumulated in 27 countries who were there in ANU, and we enjoyed the whole 4 days in Guntur in a very congenial atmosphere. And the people are very good. people are very dynamic, and also they had a nice support for this international event. So on the other hand, there are a number of papers which were presented. That time around 330 or some papers were presented in the conference. And I'm very happy to tell you, out of all those papers, one special issue of journal and 8 books by Springer has been already published. So, and many of the papers are from the research scholars and the teachers from the ANU. So that's a good sign. So there are a lot of involvement of the government as well as the APSCHE, Higher Education Council. So in that way, previously we thought that there will be only 15 papers from different universities in Andhra Pradesh. But I committed the chairman of APSCHE that there will be more than 150 papers with our endeavor. And you won't believe that in the conference, 120 papers from different universities from Andhra Pradesh was submitted and presented. So that's the thing I like to tell you. And I once again thanks to all the professors and the scholars who supported this event and for their encouragement for the research by the students and their publication. Coming back to the main topic of today, that biomedical waste management and its impact from the pandemic situation. I'll just share the PPT. You please give me the permission to share screen sharing. Okay.
You are also the co-host, sir. You can handle.
All right. So I believe that you can see this.
Yes, it is visible, sir.
It is visible. All right. So you know that today my topic is biomedical waste management and different hazards out of it. And these are the contents. So before I start, we must remember the people whom we have lost during this outbreak of COVID-19 situation. We have lost our friends, our near ones, in a very unprecedented and tragic situation, which is a tragedy of centuries. And we wish that this never happen and this will never recur in such a big size. You know that we don't know who are the creator of this situation, but we must give a thought that this type of creators should not be there in the world for making the people at a stake. See the situation. This situation is prevailing in all the states in the country, and not only in all the states, but also in all the countries in the world. So we must pay tribute to the people who are affected and who have lost their life during this COVID-19 situation. So now let us consider, already Professor Swami and Brahmaji told that why biomedical waste and what are the biomedical waste, and they have made some situational analysis already that what is the condition of biomedical waste in our country. But this is a grammar that we have a rule, and as per the rule, the biomedical waste has a specific definition, and this is any waste generated during the diagnosis, treatment, immunization of a human being, animals, research activities pertaining thereof, and in the lab, all these we call biomedical waste as per Biomedical Waste Management Rule 2016. And you know that this type of the control of this biomedical waste is a very, very important for the human being and also for the animal. Why? Because a person who experiences one needle stick injury from a needle used for any infected source, from any infected source patient, it has a risk of 30% of becoming a HIV patient, a HBV patient, 1.58% of HCV, and 0.3% of HIV. So this is the situation, this is the danger, this is the hazard out of this biomedical waste management. And the impact of mismanagement of biomedical waste management, who has a blue book which was published in 2014, they have specifically mentioned that sharp inflicted injury, toxic exposure from different pharmaceutical products, antibiotics, cytotoxin, mercury, dioxin, furan, and all these which are handled in incineration of healthcare waste, chemical burns, air pollution, thermal injury, and all these are having impact on the human health as well as the environment. And this happens because of the mismanagement of biomedical waste. You know that India has a tradition, India had a tradition of having waste management in a very poor shape. We are very happy that if I have a waste, I have some amount of waste and that is dumped into the nearby dumping yard, then I'm very happy that I don't have any waste. On the other hand, we are also very happy whenever we are discussing about the waste management and all these issues, we were very happy by saying that, oh, my city has 2 dump yards, you have only 1. So in that way, this is a pride of the people in traditionally, not only in India, but also in all the developing countries, that how many dump yards you have in your city. If I say 1 and somebody is having 3, then he is 1 step ahead of me in status, that he has 3 dump yards in his city. So this is the situation, but should we go ahead with this? The answer simply is no. So, you know that COVID situation has come in a way, but we had the biomedical waste, we were generating biomedical waste time and again, every day, every second. So in that way, the biomedical waste out of this COVID, it has given us some of the situation which is really dangerous and which is really very problematic. Where from waste from quarantine household, we never heard of quarantine household earlier before COVID. So this is a new terminology which our society is listening and utilizing. The patients having positive COVID-19 symptoms, the West suspected patients, major cities out of this, because you know that the COVID situation has given up 2 major aspects of the waste management. One is the use of plastics. We, in most of the cases, say that don't use plastic. One time use of plastic is very bad and other things. But on the other hand, plastic saved us from the COVID infection. We are utilizing most of the, gears to prevent COVID is the plastic. The doctor, the nurse who are handling this COVID people, they're wearing the plastic garments and all other things. On the other hand, the syringe, because you know, this is very dangerous situation that today, in next couple of months time, there will be generation of at least 100 crore of syringe and the needles only out of this COVID vaccination. So now think of the situation, how all this can be disposed in a very nice manner so that there is no health issue, there is no environmental issue. So these are the things which we have to be really bothered about. So these are some of the impacts of the COVID-19 situation. Apart from the human health, these are the health for environment, as well as indirectly, these are all impacting the human health. So there are some data which tells that nearly 30 to 60% of the waste in some of the cities throughout the world, they are generating more plastic waste during this COVID-19 situation. Because as I told that most of the gears are produced out of plastics. This is a very popular slide out of my research, and in most of the waste management lecture, I show this for generating more awareness among the people. So we talk about waste management. This is not a biomedical waste management. This is simple waste management, the general waste management. you see that there are a number of columns, and if you go to the last column, the landfill column, you will feel that what is the situation of waste management in the world. See, Bangladesh, Bhutan, they are putting 82 to 97% of the waste in the dump yard. Brazil, Egypt is 88% they are putting. And India is improving, of course, for last 5-6 years because of the inclusion of the Swachh Bharat mission and also Sarvekshan. India is improving a lot and at a very fast rate. So in that way, and in my opinion, next 10 years time, if it happens, that India will be able to place herself in a very nice position in the world waste management scenario. So we are improving, but Italy, look into the situation, what is happening in Italy, Portugal, and also even which is Asian country, that is South Korea. South Korea had a situation similar to India in 1980s, early 1990. They were dumping more than 80% of the waste in the dump yard. But today, I had been in Korea for many times, and their waste management is so simple and so nice. They achieved already 15.7% of waste going to the dump yard a few years back, and they had a target that 3% of the waste only will go to the dump yard by 2020. But due to this pandemic situation, they could not achieve it. But in very short period of time, in the next 2-3 years time, they will achieve that below 5% will be the waste which is going to the dump yard. So this is a situation which gives us an idea that India has a major area to work together, because you know that if you go to all the European countries, you will find not only the general waste management, municipal waste management, plastic waste management, electrical waste, electronic waste management, and also biomedical waste management. They are well ahead. And India is a very strong country with respect to the willpower of the people. So in that way, if we have a good governance, that it is possible to make the waste management, the biomedical waste management, as Professor Swami was giving some data of the biomedical waste management, that can be managed, as well as not only managed, but also you know that there is also a business component of any of the waste management. We vouch for the business model for the waste management with biomedical waste. In fact, in my opinion, the biomedical waste management is the best business model in India, because you know that each of the bed which is generated from a particular each of the bed, the rate for management of waste is fixed by the government. And if you are a service provider, you will be given that, you will get that amount. But it doesn't happen in the case of general waste, municipal waste, and others. So you have to fight for getting the tipping fee with the municipalities, government, and other things. But whenever it goes to the biomedical waste management, you know that this much is the return from me if I am involved in. Like I will also be happy to share some of the information with one of the biomedical waste management facility for which I am the mentor, that is in Mangalgiri. You know, that's nearly opposite to your university, ANU. So they are doing good. And you know that whenever I was in Vijayawada for some time, for nearly 1 year, so when I go to their plant, I told that you have to improve the waste management facility and the biomedical waste management treatment facility in your factories, so that we can bring number of foreign delegates to your factory. And I'm very happy to say that Environ Safe, they could manage. I also helped in giving them the inputs and other things, but they managed to improve the whole situation of the factory. And I'm quite happy to say that nearly 50% from 8 countries, visited their plant. I'll show you one of the photographs. So this is the situation of waste management. Now, in the COVID situation, we all know now, because even the very small kid, they know what are the types of waste which are generated out of this COVID situation. The gown made of LDP, mask, everybody knows the mask. There are some non-woven fabric which is dangerous. Professor Swami was also referring that we are changing at least 2 masks a day. So how much is the waste burden on each of those? All the masks are not COVID, coming out of the COVID patient, but we don't know that who is COVID patient and who is non-COVID patient. So we have to be very careful about that. Then PPE, disposable made bags made of LDP, HDP, saline bottle, blood container, and different PPEs, personal protective equipment, food delivery packaging, that is another. So it is not only that plastic is generated out of the COVID patient, but it is that because you know that you are not going to the shopping, you are always purchasing, in most of the cases, you are purchasing online shopping. So whenever online shopping, there is a package which is again out of plastics. So huge amount of plastics. And as I told you that from the hospital, other facilities, and the major issue now for last 2 months, we are facing that the syringe, out of this syringe, needles, and many other things, even the cottons out of the vaccine center. So all this is possible to manage if we have a very, very strong governance in the country. Let us see what is the governance. You know that India has a good legislative system and the sound waste management. When we started, we started in 1881 with the Factory Act, and Factory Act, it was revised many a time, and now we are going for the Factory Act, which was in 1949, revised, amended in 1958, and there are a number of revisions. So our basics was established in 1972, the basic environmental plan, which was evolved after the Stockholm Conference. And simultaneously, we had a 42nd amendment of Article 48 and Article 51A. These two gave a very good push in Indian environmental and waste management situation. And you know, there are a number of rules. Biomedical waste management rule is one of the oldest that we devised in 1998, the first one. And then there are a number of revisions. But very recently, in 2016, we have seen the implementation of all the waste management rules were not very effective in India for some reason or other. So taking all the learnings from different sectors, different stakeholders, in 2016, we have installed 6 waste management rules based on the 5R: reduce, reuse, recover, recycle, and remanufacturing, and the circular economy, which leads to resource efficiency. Resource efficiency is related to business. So in that way, we have hazardous waste and then other waste management, which were transbounded in 2016. Construction and demolition waste management, this is a new waste management rule. Biomedical waste management rule 2016, e-waste, plastic waste, and the overall is solid waste management rules 2016. These are the basics of our activities with respect to the waste management rule of biomedical waste. So what happens in pandemic? I was just referring to that, the enhancement of the plastics, different types of plastics, and the EDB and UN data that told that the Thailand's Pollution Control Department reported that plastic waste, especially packaging plastic, increased by 15% from 5,500 tons to 6,300 tons per day. And that is because of the food delivery only. So in that way, there are many data which are available in the website. You can get it. So everywhere you will find that there are a lot of enhancement. So what our rule says, our rule says the biomedical waste management rule, which was enacted in 1988, and then it came to 2026. Then the latest amendment was 2019 in February. So this is a rule which guides us. And on the other hand, there is a guideline on CPCB, Central Pollution Control Board. We have barcodes, how to incinerate the biomedical waste management incineration, and common biomedical waste management treatment facilities. That has also a guideline. We have a number of common captive biomedical waste management facilities and common biomedical waste management facility in different parts of the country. And it also says whose responsibility is what. I'm not going to the detail of that, but some of the things which are very important is you must have an annual report. You must have the monitoring and implementation plan of the rule of HCA, maintenance of recording. So these are very much required, because you know that if you don't have any improvement on the system for a long time, that means your system is dead. So the system improvement can only be done if you have adequate data for analysis. So that's why this is very important that you keep data and go on analyzing so that you can improve upon it. The second very important thing is because you know that waste management goes in jeopardized form if you don't manage at the source every time. It is same for the municipal waste management also. So whenever any waste, whether it is biomedical, whether it is municipal waste, whether it is electronic or any other thing, the first and foremost responsibility of the waste generator is segregate the waste at source. So if you segregate the waste at source, then your problem is less. You know, I can remember one hotel on the first floor and ground floor, just near Mangalgiri. And whenever I go to ANU, I love to take the lunch in that hotel. They give us the some foliage, that banana foliage, and rice and all these things. So sometime I thought that they give all the vegetables and dal and rice on the same leaf, and we grab it. So, but on the other hand, you can have different small bucket for all those, and then you can take it. So what happens many a day, I saw that everything mixed, and then you grab it. But on the other hand, if you have separate things, and if you take one by one, then you will get a good taste out of each of it. But if you mix everything, then you don't know what you are eating. You are eating and you are filling your stomach, but you don't know what you are eating. The same thing is for the waste. If you take all the waste together, mix it, and then you don't know which type of waste is there, and that's why you have to throw it away in the dustbin, in the dump yard. But if you separate those in different buckets at the very initial stage, then you know that which are sharp edges, which are only plastics, which are metal sharp, which are infected plastic, which are uninfected plastics, and etc. etc. So then your treatment options will be very specific for different types of. So in that way, we have 4 colors: YOLO, human anatomical waste, animal waste, soiled waste, and all these are to be kept here. So this cannot go here. And then contaminated plastic waste, it should be in the red bin. So if it is glass jar, it is blue. And what is white is the metal sharp. So in that way, this is very specifically mentioned in rules, and it is very much required also that it Schedule 1, categories of segregation, collection, treatment, processing, and disposal option. So each of you must remember that this is a very minimum required, and this is the basic requirements for the biomedical waste management. On the other hand, if you go to, I've just shown a very schematic diagram for the biomedical waste as well as general waste, you will find that the biomedical waste, whenever it is generated, separate this as per all the requirements: contaminated plastic, metals, body implants, glassware, and all these things. And similarly, if you have the general waste, then you must have wet waste, dry waste, and construction demolition waste. And sometime this year in 2016, we have a domestic hazardous waste. So domestic hazardous waste, you have to put in the black bin. Recyclable general waste, it is white, or in some of the states they take as a blue. And if it is wet waste, biodegradable waste, like say composting, biomethanation, and any other thing, you should go for a green bin. So these are the three bin, and I request all of you, if you are not having the waste bin at your home, kindly introduce this three bin culture at your home, and this will be helpful for the waste management as well as for the healthcare. So anything biomedical waste which you are generating at your home, you can put it in your hazardous, domestic hazardous waste. And this domestic hazardous waste has not to be disposed by you, but it has to be handed over only to the representative of the municipality that has been assigned as per the rule. So this is the first step which we have to very careful about the segregation. And I have also shown the segregation part of our rules, what is requirement. And you know that this is very important thing. That's why, in around the hospital, around the healthcare unit, this must be advertised very, very consciously and nicely, so that not only the hospital people, like the staff, nurse, and doctors, but also the general people who are visiting, they must also know what has to be kept what. Because there can be number of bins, but unless and otherwise you can put the most hazardous bin in yellow one or in blue one. So in that way, or the sharp, you are keeping it in the blue. So in that way, you have to be very careful about the use of the bins. So that general awareness has to be there. So now there is other scheduled category of segregation, where you know that the first thing, biomedical waste should not be mixed with other things. As I also mentioned in the segregation, that segregation is very important part for bio. Now, if it goes to barcoding, if it goes to CVWFT, like waste treatment facility, then it must be positioned with a barcode. The vehicle should be leveled. The vehicle should fulfill the condition of State Pollution Control Board, and storing should not be more than 48 hours. It should, that's why you know that for biomedical waste management, the service provider takes the waste every day from the hospital. And that's a good business, again, I'm telling. So biomedical waste management, if you install a facility as an entrepreneur, that will be really a good business, but you have to have a coordination with the government. Then the treatment and disposal, there is a standard for the incineration system, and 99.99% must be the combustion efficiency. There should not be any leftover. And the ash which is produced in the biomedical waste facility, as Professor was mentioning, that has to be kept in the specially cased landfill site. You cannot just throw it in the dump site. So that is also should be done as per the rule. And there are a number of parameters which has already been set in the law itself. So even if you have a waste treatment facility, biomedical waste management, like say incineration or autoclave and other things, all the temperature, time, pressure, and other things are fixed, including the ambient air quality. So then comes that, you know that in Level Schedule 3, there is an authority and corresponding duties. I am not going into the detail of that. It is specified in that particular rule. But most importantly, leveling is very important. In Schedule 4, the biomedical waste container or bags, that must have a level. Transportation system has a level. And then any accident, there must be a reporting. Because you know that accident doesn't mean that somebody, it is a fatal accident. Accident includes also near miss cases. There could have been an accident but has not happened. So in that way, reporting of near miss cases as well as the happened cases has to be reported very nicely, and there should be the analysis of that, why it happened, so that there can be improvement. So all these forms are there in the rule, and the site for common biomedical waste treatment and disposal facility, that selection of the site also has to be as per the rule, because you cannot put that facility in a place where thousands of people are living. So in that way, there are some responsibility. So this also, I have made this. Say you have I mean, you are creating, you are generating the waste. I mean, whether it is symptomatic or asymptomatic, you have to first segregate the COVID waste. Anything, whether gloves or mask or any other thing. Then this COVID waste generator segregate and sort. If it is infectious, put in other place. If it is non-infectious, then you can go for co-processing in the cement plant or waste to energy plant, because huge amount of waste, it should not go to the dumping yard. So all the non-infectious can go, and you know that co-processing in Andhra Pradesh, there are a number of cement plants who are going for co-processing of the waste. So this is, and for on this co-processing, I'm doing my research work for last 7 years in different cement plants. And you know that now we are making people and also government aware that co-processing is the best energy recovery facility of waste. Any type of waste it can take, and it is far, far better than incineration plant and waste to energy plant. So this is one. And if it is infectious waste, then you have to go to biomedical waste facility for incineration and autoclave. And these are some of the figures I have shown you, that if it is incineration, then you have to put, I mean, this is the way you have to design your vehicle even, so that you separate all the types of waste in the vehicle whenever it is transporting. So there's for the treatment of CBWTF, and you take those things and it should go to the CBWTF. So the waste transportation system also having the same system of separation and segregation of waste bins as it is in the hospital or healthcare unit. And this is the way. Like, you have to be very careful, even the doctors, you have to have the system in place so that I mean, each of the places in the inside the hospital, there should be all 4 waste bins. So in that way, each of the person in the healthcare system must be trained very carefully, because you know that you may have bins, but if you don't know, then you will place the different I mean, material or the waste in other bins. So this is a figure for your Andhra Pradesh, and there are a number of waste treatment facility, biomedical waste treatment facility at different places. I thought that this will be of interest to you, that these are the district and total number of healthcare unit covered, healthcare facilities covered, and total number of beds covered, and total quantity of biomedical waste collected from member HCF kg per day. So you know that, that's why I was telling that you know how much waste is generated and how much waste you will get for your facility. And you know also per bed what is the income will be generated if you take this waste from the hospital. So you know what is the income you can generate from the biomedical waste management facility, which you don't know in case of composting, which you don't know in case of other waste treatment facilities. And you know that Medicare, another biomedical waste treatment company, who are working very well throughout India. So these are number of plants which they have in India. And you know that from this waste, biomedical waste, who are the people at risk? Doctors, paramedical staff, ward boys, sweepers, municipal workers, patient, attendants, and public at large. So it is not only that the doctors or the paramedical staff has to know this, but it is necessary in general that these are the people, including the public at large, should know what is the separation and the segregation system and what is the impact of biomedical waste on individual. Look, this is some of the photographs I have taken from, and the impact is on the environment, health, occupational, and airborne disease also crop up from this biomedical waste. Leachate, of course, soil dumping on soil. So there are a number of hazards which can come from the biomedical waste, including the airborne release of pathogens. So we should be very careful about the biomedical wastes. So we have to manage, because this is, we are socially and morally responsible. It increased, it should be, we should increase the awareness in the society, because these are very dangerous. And there should be number of NGOs who work. And of course, we must have a very, very effective legal framework, and there must be a good governance to see that the legal framework is working. So training is necessary, segregation I have told, color code I have told, and now in next 5 to 10 minutes, I'll just complete my lecture. So I'm not going into the detail of that now. You know that I want to show you, because I'm sure that many of the people are not in a position to visit any biomedical waste management facility. So I'll take all of you in biomedical waste management facility and want to show that how it is, what it is happening. This is the building, forget it, not this. So waste is collected. See, these are the bins, separate bins. It starts from the source and now it enters into the waste management disposal facility. So this is incinerable waste, the storage, and then autoclave, and this goes to autoclave, and this incinerable waste goes to treatment, and then ultimately it if there is any ash, it has to be taken care of very carefully for the landfill side. So for collected waste which go to autoclave, this is mainly disinfection, and after disinfection, mainly the plastics and other things, then you can go for shredding, and whichever are recyclable, it goes to the authorized recycler, and this is a good business of plastics. Of course, there is again restriction by the rule and the government that you cannot use these waste plastics for any application, but there are some specified application for which you can do it. So this is one of the facilities, as I was referring, that safe environment. This is a biomedical waste management facility, and see, all these were developed during this 2018. We told that you must have a good garden also, you must have a water from the ETP which can make flowers, so that this is, and there are fishes also. See, this is the fish, so that the quality of water treatment can also be envisaged. So this is the incineration which is taking place. And this is also, yeah, this is the incineration which is taking place in the factory. And you know, this is also inside this is autoclave is done here. And you know, this is the whole compound and you cannot see any waste here. So this is as good as like any other factory. So I was very impressed. People were very much impressed by seeing the facilities, quality, environment, and other things. So these are the people who visited, and this is another facility, which is a Medicare facility. It is in near Gurgaon. See, again, the vehicle comes, and this is for the autoclave, and this is for the incineration. These two are very much diverted field of operation, and it goes by the separated waste. So whichever are non-infectious or infection to a little bit, you should go for non-infection disinfection at a very high temperature by autoclaving, and then shredding. Then it can go to landfill and it can go to recycling. And of course, for incineration, all these materials from different bins, separated bins, yellow bins, it should go to incineration, and you cannot recycle these waste which are generated from here, and this incineration from the bottom ash and the top, whatever fly ash and bottom ash, whatever is generated, you should go for a restricted landfill. So this is also the photograph, and you see the cleanliness in the factory. This is the Medicare factory, and this is the incineration plant, and all this material handling. So the material is taken from here and it goes to all the places. But I was interested to show you some of the photographs from one of the waste management facility in Thailand, but I could not find those photos. That's why. But our factory, I'm very happy that our factory is very clean also here. This is a Gurgaon factory. And these are all the facilities. This is an autoclave and needle cutter, like what you see in the vaccination center today or any other syringes. So this is a needle cutter. If it happens that there are some needles, so they cut it. Then these are all cooling tower, pressure vessel, and all these things, filters, shredder, mainly for the plastics. And of course, stack emission is another issue. You have to be very careful about particulate matter, nitrogen, oxide, NOx, SOx, and other HCl, dioxin, furan. Of course, dioxin, furan possibility is very, very less because the temperature is very high. And of course, there are some rules, quarterly, annually, all this. And water treatment and landfill. And you have to keep the record. Government will come and see what is happening, the pollution control board people. And this is also one of the facilities in Delhi, which takes masks, gloves, and other things. And of course, there is a system in India, Government of India, we have a guideline for handling COVID-19 waste. So that is also available in the website. But you know that biomedical waste management is the basic rule for any waste which are generated either from the COVID or non-COVID situation. So only for the COVID situation, COVID waste, there are some special treatment which you need to do, and rest of the part is more or less same. You have to disinfect, you have to use disinfectant for this type of waste which are generated from the waste. But one has to be very careful about the COVID-19, that waste generated from the COVID-19, unless and otherwise you cross 72 hours, it is better not to handle by any people. And this is very important that you must have a strong legislation. The government must support for the monitoring and the facility enhancement, enhancing the capability of the people who are handling. And we are very happy to say that in India now we have a very, very big force for handling COVID-19 situation with respect to the medical waste management as well as the vaccination system and treatment. Of course, there is always a scope for strengthening the healthcare staff and others. Financial support is a very important, but on the other hand, financial support for the biomedical waste management, I repeat it, it is a very good business proposition, and it is a very good business. It has already a very good business model in India. You cannot go and install a biomedical waste management facility anytime. So you have to take the license from the government, and the government will assign you that this is your zone. That means your market is fixed. You cannot take, some other person cannot take the biomedical waste from your zone. So you are the king of that particular zone. So all the business will come to you. So the business is very easy, and you know how much will be your profitability and your, so if you can reduce by improvement the process cost, then your profitability will be always more. And with respect to the COVID waste handling, you have to take care of the emotional and scientific aspect, because the people who are handling your COVID waste and even the dead bodies, you have to pay respect to them, because you know that whenever you are not even allowed to touch the body of your next to kin or your close people who are died, but on the other hand, because of infection and other things, but whenever, on the other hand, some people are handling it very carefully. So we must pay respect for their emotion and for their support services. And you know that sustainable development goals, most of the sustainable development goals are, the activities are now affected by the COVID-19. I'm not going to the detail of that. And the same thing is here. So my bell is ringing for 50 minutes. And these are the countermeasures for all these things. So this is also available. If you want, I can send you. I'm not detailing again. And of course, awareness, commitment, containment, legislative framework, segregation, storing, and disposal. And this segregation, storing, and disposal, I am requesting all of you, because nearly more than 400, 500 people are here. Kindly install the system of segregation of waste at your home, because you know that is not only for you, that is for your children, and for the next generation. Each of the waste has to be separated and segregated at the source, and then the waste will have a value, and it can go for recycling, and resource efficiency will come. If you don't separate, if you don't imbibe the culture of separating waste at source, you can never go out of the waste management problem. So the first and foremost thing which everybody must think of it and do it is separate waste, and then go for recycling. You cannot recycle, but you hand it over to the recyclers. You can sell it to the recycler. You can also earn money from the recyclers. And by this way, you are helping the recyclers to earn money, to treat the waste. And this, if you go for treating the, separating the waste, handing over to the recyclers, recycler recycles the waste, then ultimately you are helping to a greater extent to the globe to reduce the extraction of the natural resources. So for your very small effort of segregation of the waste, you are helping the globe by reducing the extraction possibility of the natural resources, which will go for a sustainable development. So with this very small effort of you, you can help in achieving the sustainable development throughout the world. So that is my request to all of you. And with this, I must thank once again Professor Swami and Brahmaji and the team for inviting me to this very august gathering and sharing my views and learning from you. And thanks to all for your patient hearing, all the participants and my friends. Thank you very much. Over to Brahmaji and Professor Swami.
Oh, okay. Thank you, sir.
Questions?
Thank you, Professor Sadhan Kumar Ghosh garu. You are given excellent information from basics to the advanced mechanisms related to the biomedical waste, and also you are giving quite number of examples relevant to the pandemic as well as the COVID-19 situation. I'm very happy to interact our participants, and also we are giving a YouTube link. We will send it to you, sir. You can also visualize. And at the same time, some of the good appreciation from the participation. Your slide presentation is very good. And at the same time, you are giving a excellent information related to the total biomedical waste as well as the other waste, and the common biomedical waste treatment plant designing. You are also given. And who is the authorized recyclers in biomedical waste, sir, actually?
Like in Andhra Pradesh, there are 8 authorized biomedical waste treatment facilities, and 1 is in Mangalgiri, and 3 or 4 is in Vizag, and there are some other places. So in that way, in total Andhra Pradesh, there are 8 or 9 biomedical waste treatment facilities who are authorized. And in each of the states, there are something like that, which are authorized by the State Pollution Control Board.
Recyclers after autoclave.
Oh, that can be anybody. I mean,
Anybody.
after autoclave, the recyclable parts, if you have, then you can sell it. The part which needs to go to the landfill site, that has to be handed over to the authorized dealer, authorized agency by CPCB. But other part which can go for recycling, that can go for any recyclers, and there are a number of recyclers list also which are available with the Pollution Control Board or the Biomedical Waste Management Facility, so they can sell it to them. Because there is no restriction for that, excepting for use of something, some of the use. Like it cannot go for food packaging. It cannot go for, there are some restrictions which are already available in the rules. So they should go according to the rules only. And you know that from biomedical waste management, all the recyclables, whatever are sold, the history of all should be logged, and that should be sent to the Pollution Control Board. So there is a monitoring mechanism.
Okay. Sir, some of the questions can be asked by our student Rupa Sravanti, sir.
Please, please.
Rupa Sravanti.
Sir, good morning, sir. I'm Rupa Sravanti from Nagarjuna University. Sir, here is a question from Krupa from Acharya Nagarjuna University. So we know that we have many expired drugs that are stored in hospitals. Can you please tell how do they dispose those drugs and how do they affect environment?
The expired medicines, right?
Yes, sir.
Yeah, very good. Expired medicine, you know, again, I told that co-processing of waste in cement kiln. So that is the best way that can be handled. And the government rule, like hazardous waste management as well as solid waste management rules 2016, both refer to that this type of waste can go to the co-processing of cement in the cement kiln. So if you have such cases and they are not doing it, then instead of giving it to others, because you know that if these things are given to other, I mean, those who are purchasing this type of thing, that there is always a possibility of misuse of this medicine to the poor people in the villages who don't know the English and reading all these things. So it's better always if you can install this system with some cement plant, because in Andhra Pradesh, there are cement plants, 2 or 3 at least I know, who use this. So in that way, that is the best way of disposing any expired medicine. Thank you.
Okay, sir, another question. Can chlorine-based disinfectant can be mixed with any other cleaning agent?
What?
Can chlorine-based disinfectant can be mixed with any other cleaning agent?
No. That I don't know. I'm not expert on that, but any chemist can tell you that whether it, because you know, it depends on which disinfectant and which chemical you are mixing. So I cannot put any general comment on that. I mean, your chemist in the lab or chemist in the hospital can do it better. Okay.
Okay, sir.
Generally not, sir. That
Yeah.
chlorine is as a disinfectant that was used in a biomedical waste treatment facility. It is not supposed to be reused, sir. Because
So see, the
then
expert
it is
will be you only.
cytotoxic.
The
That is
expert will be you
cytotoxic.
only. That's why I told
Yes,
that I
yes.
don't know much about that. Yeah,
Okay. Next, Rupa.
please.
Sir, another question. Sir, you said so South Korea had improved a lot in biomedical waste management. So can you please tell us what are the techniques they prefer for disposal of biomedical waste?
Techniques, there is no dearth of technique. Whatever we are doing in India, the same technique they are also doing. Only thing is that they have some automated system, right? But most importantly, the management and governance. You know that if the same facility can bring some good machineries and others, then it can be very nice. Their efficiency can be good. So in that way, there is no much of difference of the technology. But only thing is that the governance, the management of the waste, the reporting of the waste, all those things are very nice. And the collection facility, because you know that in India, even today, there are places where the collection system is not adequate. So these are some of the things which are very good. And I will ask you that if you permit, your institute is a big institute, and Thailand or Korea is not far from here. After the pandemic is over, a group of students go to Korea, see all the waste management facilities, and come with a very nice idea of what is happening, and you implement in your country. And if you need any help, let me know what help you want, accepting the money.
Sure, sir.
Okay.
Sure, sir. Another question, sir. We in India we just have 8 biomedical waste recycling centers. So how
Not
to
India, not in
AP.
India.
Sorry, in
In-
Andhra Pradesh. In Andhra
Yeah.
Pradesh. So how to manage this this much of population? We have a lot of population here. So how to handle
No, you are
lot of
not.
waste?
You are not to calculate the population. You calculate the number of bed,
That's
number of hospital,
Yes.
and number of beds, right? Because as I told you, the government has already, systematized the number of facilities for total number of bed, and on the basis of that, the capacity of the plant is also decided. Now, it may happen that in some of the district, it has not yet been done. And what they are doing from that district, all the hospitals, the collection is done by the facility which is, situated in other district. So in that way, this number of facilities, whether it is adequate or not, you are not to calculate the population density, but you are to calculate the how many hospitals and how many beds are there. So in that way, this is very much dictated by, the CPCB as well as the number of hospitals, number of beds. Okay.
Okay, sir.
So, last question, sir. We know that mercury is a very hazardous chemical. So it can be disposed along with medical waste, biomedical waste or not?
Which one?
Mercury, sir. Mercury.
Oh,
Mercury.
do you have any mercury with you? In your lab? Look, it's very dangerous,
Okay.
right? Mercury, handling of mercury, disposal of mercury, it has a totally separate system and the procedure, and you have to follow it. And this is being controlled by the government of India. So in that way, there is a system of handling, storing, purchase. Even you cannot purchase mercury anytime, right? So in that way, if you need it, it has a specific procedure for purchasing, handling, and disposal of mercury. So that you have to follow. I am not a master on it, but and it has a that Minamata Bay problem.
Yes,
So,
yes.
all this, so
Japan.
in that way, yeah. So in that way, if you are really interested, you can have the document in the CPCB website, and you can get it.
Okay, sir.
Okay.
Sure, sir. That's it, sir. Thanks a lot, sir, for answering our questions very patiently.
Thank you very much.
Thank you, Professor Sadhan Kumar Ghosh garu.
Thank you, sir.
Oh, you can
Oh.
use your resources in future endeavors also. Thank you very much and sparing the time and giving the valuable information, and also the awareness is given to the students particularly, and also the what is going to be happening in our Indian scenario. You are a good live examples in our Andhra Pradesh, particularly. We are also not much aware that, but your presentation is having the full-fledged, clear picture. Thank you very much. Thank you very much,
Thank you.
sir.
Thank you. I had been also the mentor of Tenali municipality for their waste management facility. You know that.
Yes,
no?
yes, sir.
Okay,
Yeah. But now I don't know what happens to that.
yeah.
Okay.
So the other thing which I like to mention you know that the conference which was referring to Professor Swami,
Yeah.
Professor Swami and Professor Brahmaji is also the member of our committee. So
Yes.
this year, the 11th ICON SWM and Circular Economy and also IPLA Global Forum, that will be held from December 1 to 4 days on, virtual platform.
Okay.
The submission of the paper is around August or September, and you can submit. That's a very good conference. So you will get it from Professor Brahmaji and Professor Swamiji, all the detail of that. So you are welcome to that conference. That's a very big conference in India, the international.
Sure,
and we are
we can
expecting
submit.
around 40 countries to participate this year.
Okay.
Thank you.
We will let the groups know who have not participated in this particular seminar.
Sure.
So we used to have a continuous interaction, so many groups. And now for any seminar, it is not less than 1,000.
Yeah.
Not less than one. The webinar made is very easy to interact with the people from different corners of our country. So
Thank you.
let us hope
Okay,
for the
thank you,
best
sir.
and the
Even
maximum.
Thank you.
The maximum people.
I'll be here for some time to listen, Dr. Bijay,
yes.
and then I'll leave.
Thank you, Professor.
Okay, thank you.
Very informative.
Okay.
I'm looking forward to meet you sometime.
Sure. You are always welcome.
So,
Swami, sir.
Nilofar,
Yes, sir.
you're talking with you introduce Vijay Kumar,
Sure, sir.
Now before that a small interruption. I take liberty to call Professor Reddy, TB Reddy, Andhra University, the senior most professor of environmental science, Andhra University, in the state, a senior most professor in the state, and also is now
state environment
member in the SCEEED committee of AP Pollution Control Board. Now I request Professor Reddy garu to speak a few words. Unmute Reddy.
Raju.
Shashi. Shashi there?
Okay, sir.
Swami.
Okay.
Okay.
Thank you, Brahmaji and Swami, who are my good friends since 30 years. Recently, I was appointed as a member in the State Environmental Impact Assessment Authority. So anyhow, today I had a very, very good lecture arranged by my friends. So anyhow, it is quite informative and also useful to most of the people. But only the problem is, whenever we are going to conduct this type of webinars or seminars, much of the information is not going to the public. That is the major problem. So, and also India is going to be considered as a rural background. People are going to be there. But what is going to be happen? So most of the people may not know much about this solid waste management or biodegradable waste management. So you have to go for the villages to educate the people about the impacts of these things. That is very, very essential nowadays because of this COVID. So how the COVID effect is there. because of the imposition or also the lack of knowledge about these organisms, how they are going to be affected. That is also one of the reason our mortality rate is going to be very high. So this mostly nowadays urbanization is going to be coming up very rapidly because of various reasons, who are coming from migrating from other areas to in the name of employment or their settlements. Automatically, when the people are going to be, waste is going to be generated day by day, thereby you are going to have less dumping yards. That is the one of the problem nowadays. Based on that, you have to create more dumping yards and also the more incinerating units for the recycling. And even though you are going to have a lot of loss, the strict implementation is not there. That is why you are in a position to have different types of diseases and contamination like that. That's why I request you people to educate the people as much as possible. Otherwise, to control this type of impacts by the biodegradable solid waste management is not possible. So, because of at least in Andhra Pradesh, we have the system about the volunteer system. They are going to get the information and pass on to the administration. So for this, interaction between the administration as well as the academics are very, very important. So once again, by this, I thank the Professor Ghosh for giving valuable information to the people. Thank you.
Thank you, Bhaira Reddy. Thank you.
Thank you, sir. Bhaira Reddy ji.
Thank you, sir. Nilofar.
Sure, sir. Just a minute.
Okay. Yes, okay, visible.
Thank you, sir. I would like to thank for giving me an opportunity to introduce the second speaker, Dr. N. Vijay Kumar, sir. Sir is an associate professor.
ఒక్క నిమిషం నీలోఫర్
Okay,
sir, continue చేయండి సార్, కంటిన్యూ చేయండి.
సర్టిఫికెట్ ఆఫ్
అంటే స్క్రీన్ షేర్ ప్రాబ్లం అయితే సార్, ఇప్పుడు చేయండి, కంటిన్యూ చేయండి.
ఓకే ఓకే కంటిన్యూ విజయ్ కుమార్.
Sir is Vijay Kumar, sir is associate professor in the Department of Microbiology from Acharya College of Applied Sciences, University of Delhi. Sir is also having a very good industrial experience in the area of microbiology. Sir has done his bachelor's in microbiology, biochemistry and chemistry, and his master's in biochemistry from Andhra University. And sir has completed his research of MPhil and has been awarded PhD in the field of microbiology. Sir has a lot of academic achievements. Sir has cleared junior research fellowship, senior research fellowship gate, and also sir is visiting scholar for Chinese government research exchange program in the year 2017. Sir has successfully completed different research projects, which I have mentioned here in the slide. Sir has in international journals, and sir has different awards. Sir received Dr. Radhakrishna Gold Medal Award in the year 2018 under area of education by Global Economic Progress and Research Association Society. And sir has also received a Best Paper Presentation Award on Fungal Pathogens in a conference held by Indo-Caribbean International Conference on Development and Optimization of Methods for the Analysis of Pharmaceuticals, sponsored by Madhya Pradesh Council of Science and Technology, held in the year 2018. And sir has served various, has been awarded different awards and appreciations and recognitions. Sir has served different administrative positions as the teacher in charge in the Department of Microbiology in University of Delhi. And sir is the convener of Equal Opportunity Cell of BCAS for the year 2020-21. And sir has been serving different administrative positions during his career. And sir has supervised successfully two research scholars and who have been awarded with the PhD. And sir is having different academic achievements, has participated in more than 8. Thank you, sir, for accepting the request and giving today your time for us. Thank you, sir.
Thank you, Dr. Nilofer, for your kind words. I'm truly, thank you, ma'am. At the outset, I would like to thank Dr. Shashidhar as well as Dr. Bhadra for bringing me onto this platform. Recently, I have given one lecture on World Environment Day. Dr. Shashidhar has seen that one and had given me this opportunity to meet with stalwarts like AVS Swami sir, Brahmaji Rao sir, and above all, my co-host, the other resource person of today's seminar, Dr. Professor Sadhan Kumar Ghosh. It is truly a great pleasure for me to be here. So unlike the present, what Professor Sadhan Kumar has presented in a very systematic and quantitative manner about the impact of biomedical waste. So unlike that, my presentation is more towards the effect of biomedical waste and other kind of waste on environment, as well as what kind of steps we can take in order to mitigate, in order to reduce, or in order to recycle our environmental issues caused due to COVID-19. So my presentation will go in a more student-centric manner, in a way that to excite them and to encourage, inspire them so as to take novel steps towards the waste management. So without wasting further time, I would like to start my presentation. Hope I am audible. Swami sir, can you please confirm? Brahmaji Rao sir?
Sir, audible, sir, audible.
Okay, thank you so much.
Yes, sir. Screen sharing is also coming.
Okay. So this very beginning picture should reflect, maybe either it is 1 mask or 1 billion masks, the kind of impact it has, negative impact it has on our environment is today's my focus. More said than less done is the situation of today's condition. We have a lot of information about the wastes that cause the different kind of problems. We have different kind of principles of waste management, but with respect to the kind of population, the 500 billion plus population producing lot of waste, and they are causing problem to environment. Today, COVID is killing humans. It is because of the gross error committed by humans to the nature. Okay, do not take mistake from my side. Do not take it mistakenly, but this is the reality that everyone knows, that we played with nature, so nature is playing with us now. So students, today's my topic should inspire you towards taking up waste management as a career in order to build your career into a beautiful career and beautiful world you will create. So because you are the pillars of tomorrow's nation, so that is the reason I want to show in that manner. So myself, those who did not listen it properly, myself, Dr. Vijay Kumar, I'm working as associate professor in Department of Microbiology at Acharya College of Applied Sciences, which is a constituent college of University of Delhi Central University. So Mahatma Gandhi once said regarding cleanliness that when there is cleanliness both inside and outside, that is the true approach of godliness. So this particular word says balance. There should be a balance between cleanliness inside the body as well as cleanliness in your environment. That is the true godliness. So today's my presentation will have contents waste, environment, and disease, how they are linked, different types of waste, although we all of us know, but those audience who do not know this, I would like to briefly present what are the different types of waste, and out of that, what are the hazardous waste, how biomedical waste and hospital or infectious waste is related to the today's topic of discussion, and how we should handle this, and then suggestive approaches. So here I have presented how waste, environment, and disease are interconnected with each other. You can see that a plastic that is thrown in a reckless manner is being consumed mistakenly by a tortoise here, and this is one example. And because of the imbalance between environment, severe industrial production, you can see that birds are killed, and then there is pollution in the environment, drinking water. Then you have origin of diseases like coronavirus, Ebola virus, and other new kind of varieties of viruses are coming up. So that is causing a great challenge on our earth. So the current challenge is to create our earth into green, healthy platform for living. That is the gift. That is the best gift that we can give to our future generations. So these are some pictures which are available in the net, which have mobilized my heart. They wrenched my heart, because you see these are the kids, poor kids who are innocent, and they do not know the cause of the kind of plastic, different pathogens these plastic as well as the garbage carry. And you can see the elephant, how this innocent elephant, doesn't have fresh water to maintain itself to drink. So it is the waste, the tremendous waste is impacting our future. It is impacting the environment, and then you can see once upon a time in our childhood days, we used to see mountains, small hills around the city, but these days we see hills, but they are made up of waste. So that is the condition, and one person is lying on this hill, waste hill. Okay, this is a pic taken from Delhi, not by me, but a popular journalist. And you can see the liquid waste problem, how the spillage is causing problem on the severe workers. So these four aspects: one is the future generation, environment, current scenario of the public, and healthcare, and different sewage maintenance workers, how this is linked. Every day we see that mountains of trash is getting accumulated. Starting from year 2000 to 2015, if you see, just in Delhi, the percentage of the garbage that has increased is 2075%. 2075%, that is 400 tons per day to 8,700 tons per day, following the industrialization. This is a huge problem today, and this is not going to stop. And the COVID has caused much more problem to this current problem of the waste. The scenario is more or less similar worldwide. Worldwide, if you see, solid waste, if you see the kind of accumulation, it is being increased from 2010 to 2015, and 2030 the levels are projected in that they are this within South Asia, this is going to increase from 466 tons per person to 661 tons per person. So if you consider, India is much more safer side, we are producing much less amount of waste when compared to North America and other regions, some other regions of the part of the earth. So that is the good news, but we do not have technologies, we do not have policies to quickly dispose of the waste and create clean environment. So that is the drawback we have. So without wasting time, I just want to give briefly about what are the different types of waste and how they can be classified, because that is the foundation of biomedical waste, understanding biomedical waste. So you know that waste can be classified with regard to their impact on our health. Waste may be classified as non-hazardous and hazardous. That is, hazardous, non-hazardous are those which do not cause major issues, or you can say epidemics like corona or pandemics. They do not cause outbreaks of disease, do not cause, and they can be easily mixed up into the environment, like food waste, agricultural waste, kitchen waste. So mostly household waste, bioorganic in nature. Even hazardous waste also may have bioorganic in nature, but the food waste, agricultural waste, they derive from the plant and then again mix into the plant. So that is the major difference. And whereas hazardous waste, this is mostly industrial oriented, or you can say this is commercially derived, which has the features of ignitability, that it can catch fire, or corrosivity, it can damage environment, then it can react with the environment, it can cause the infection of the disease, and it is toxic. So there are different kinds of hazardous waste. Somebody asked mercury. So mercury, suppose it is a hazardous waste, heavy metal waste. So for example, you have other kind of waste, which I will tell, biomedical waste. They can be like, biomedical waste is the most important one out of all this, and you have industrial waste and electronic waste. You can classify waste into 3 different types based on their state, what kind of material state they have. So solid waste, liquid waste, and gaseous waste. So 3 different types of waste we have. So solid waste, like plastic, metals, paper, and scrap, cardboards, syringes, injection, all these metals, these come under solid waste. And liquid waste, you know that oils are the best examples of the liquid waste. Then domestic washings. Then gaseous waste, we know this is the tremendous huge problem, gaseous waste, although we are not going to focus on this. So mostly today we will be focusing on solid waste and liquid waste. So solid waste, just for the presentation, I have given these pictures, like for paper, glass, plastic, metal. But these the color coding may vary from country to country. So do not take this slide as the exclusive one. So solid waste is derived basically from 2 important regions, household and commercial. Household means kitchen, apartment, colonies, residential places like this. Whereas commercial kind of solid waste comes from institutions, small scale industries, hotels, hospitals, markets, leisure houses. So in fact, biomedical waste is a kind of the commercial waste that is derived from the hospitals or healthcare centers. So you have organic waste, plastic waste, and these are the different, all this together is referred as the municipal solid waste, where you have all different types of solids are mixed up. So because of our practices, we lack certain practices. So municipal solid waste contamination is causing huge effect on our environment. So if you compare our Indian cities with developed countries, okay, most of this data, some of this data already Professor Sadhan Kumar sir has already shown, but this is the latest data of 2018, shows that in India, the bioorganic waste, like food waste, is much more high. Almost 50% of our people waste food. Not only food, it also involves, of course, biodegradable waste, other kind of waste, but 50%, because we lack technologies which can convert this into energy and manure. So that is the reason we have 50% of the waste as the bioorganic waste. When compared to developed nations, we have just 20%. Okay, India is a being developing country. It is construction activities continuously going on. So almost 30% of our total waste that is generated from our Indian cities is made up of silt and construction material. That indicates that a lot of construction is going on, whereas only just 17% of developed countries produce, 17% of the waste of the developed countries is just made up of the this construction material, because they already spoiled. They already spoiled, and we are just taking footsteps of them, going towards the developing nation. So, so that is about solid waste, which they cause a lot of problem. Whereas coming to liquid waste, you know that every house now we have water filter, that is further causing problem. So, and because this liquid waste treatment is one of very costly one, so very difficult to treat it, because that has different grease, oil, sludges, and washed water, dirty waters. All these should be dumped either into the outside the city, into the river or into the ground. So they cause they are poisonous. They cause groundwater pollution, and also safe drinking water becomes a costly burden. And they result into, when they are released, these oils released into the fresh water, then they create biological oxygen demand, what is called as BOD. This biological oxygen demand, because of this, different microorganisms increase in their number and cause different outbreaks like cholera, dysentery, typhoid. All these diseases are because of the contamination of the water resources. You can see that a huge amount of oils are causing problem onto the aquatic animals and birds. So they have negative effect, and there may be time that war may come because of the drinking water. So the situation is already there. So so without much elongating this one, the solid waste, the component of solid waste has one particular content called as hazardous waste, the one that may be hazardous, that is dangerous both to the environment and human, is called as the hazardous waste. Within that, the major one is the biomedical waste, or it is also called as the infectious waste, because this causes the infection in form of microorganisms. This can cause the infection, and they derived from biological system. These pathogens, whatever pathogens, bacteria, fungus, you have today black fungus is there along with coronavirus, so huge problem, and different viral diseases. All these can cause the infection. So that's why this is called, this biomedical waste may be referred as infectious waste. Already Professor Sadhan Kumar sir has defined what is a biomedical waste. What biomedical waste refers to: it is any type of waste created during or after diagnostic process of biomedical research or testing, a treatment of condition or a disease, or due to the immunization program. Today, because of the vaccination, huge vaccination, you know that 2 times of dose, our Indian population 1.2 billion has to undergo 2 times vaccination. So all those plastic will be great challenge for recycling. So the biomedical waste majorly comes from 3 different places. First one is healthcare place, research center, and other minor places. So major sources of biomedical waste are hospital, nursing homes, trauma centers, vaccination centers, blood banks, clinical labs. All these are the major sources from where this biomedical waste may come. Then you have research centers where animal as well as animal research take place, clinical trials take place in order to find drug capacity, drug activity. Research center perform different clinical trials. They also. Then you have mortuaries, autopsy centers, dental clinics, cosmetic. So these you can divide these biomedical source into 3 different types: healthcare, research centers, and other resources, other places. So how can we classify biomedical waste? Biomedical waste can be broadly classified. There are different type of classifications, but this is the classification that is available, as well as I added my own knowledge. So you can put this as the infectious waste, pathological waste, the one that is derived from clinical labs, pathological waste. Then you have shock waste. Already it was explained, because of the needles, broken glasses, all that causes the shock waste. You have pharmaceutical waste, the medicines which are expired. You have biochemical waste. Suppose in hospital, in clinical lab, they take the sample, blood sample or urine sample or excreta, that is left over after mixing with the biochemicals. So like that, you have chemical waste, you have that also comes under the biomedical waste only. Heavy metal waste is there. The mercury example, best known example, that is used in thermometer as well as the blood pressure machines. So if it is broken, then that becomes as the waste. You have pressurized containers, and then you have radioactive waste, which is one of the most important of all this, which cannot be degraded easily. So like this, we have 9 different types of waste broadly can be classified, although you have several other types. So, so we broadly classified this into infectious and non-infectious waste. Within infectious waste, it may be biological derived or sometimes non-biological derived infectious waste. But non-infectious waste is the one that is any kind of waste, whether it is biological or non-biological, which is safe to dispose. So if you look at total composition of the biomedical waste based on their infectivity, most of the, means approximately 80% of the biomedical waste is non-infectious, is safe to handle. Okay, it is safe to handle, recycle, reuse, or reuse, recycle, or recycle. So one can apply 3R principle with respect to non-infectious waste, which is approximately 80% of the total total biomedical waste. And if you look at some pathological waste or infectious waste, that contributes just 15%, and other 5% will be radioactive waste, cytological sharp waste. So although their percentage is less, but their impact on environment is more. So if you look at pathological waste, we have different kind of pathological waste like excreta. I already said body parts, body fluids. These part of the treatment comes from the hospital. Okay, they should be properly disposed of by putting into the plastic bags, double-layered plastic bags or single-layered plastic bags, and then they should be safely disposed. If you take the sharps, if you take the sharp waste, then you have different kind of sharp waste like needles, infusion sites, and scalpels. These, when they just they are very easy to infect persons handling with them. Suppose a used out injection needle is thrown, then it can spread the infection to the person who is handling that one. So it is a huge problem today. In fact, the sharp waste, whatever the percentage that I have shown, that may be changed. That may be changed slowly because the percentage of only 1% of sharp is showing. But with the mass immunization program, this percentage is going to change. You have other kind of waste like genotoxic waste, which can interact with genetic material of human body and can cause cancer as well as birth abnormalities, different kind of diseases. So they are called as the genotoxic waste. You have chemical waste expired. Some chemicals may be expired, so they should be disposed in the lab, from the lab. I will tell what kind of methodologies we can follow in order to dispose these heavy metal chemical waste as well as genotoxic chemicals. I want to give special emphasis over this radioactive waste, in that the radioactive material, most of those who are not from science background should know that these radioactive chemicals release energy in form of X-rays, gamma rays, and beta rays. Like this, they emit radiation. The way our cell phone emits radiation, in the same way, the radioactive material also can emit radiation, but there is a lot of difference. So when they interact with our genes are made up of DNA, they break the DNA, and our functioning of the body functioning will be disturbed, and that can cause cancer as well as birth abnormalities. So these radioactive materials are mostly used in X-rays, CT scans centers. These are the major sources of radioactive material from where this comes. When it comes to pharmaceutical waste, you have expired medicines, drugs contaminated, and contaminated water is banned. Medicines are there. So damaged pharmaceutical compounds, all these should be properly dumped, properly treated, and then they should be discarded. Otherwise, they cause a lot of problem to our environment. You have heavy metal ash on the like lead, mercury, which come from the thermometers, as I said, and there may be some other instruments. Hospital waste also contain pressurized containers like gas cylinder, oxygen cylinders. Now, government is procuring so many oxygen cylinders. Okay, once the corona situation is finished, then again we all sit together and we have to discuss what to do. So the problem with our system is that when we are finding a solution, we do not look at what kind of consequences that particular solution has. Science has created the solution, but it did not look at consequences of that solution. Okay, consequences like you have gas cylinder now, oxygen cylinders we are procuring, our Indian government is procuring in huge numbers. Once the corona pandemic is finished, then what we have to do with all those containers? We don't have backup plan. This is the problem today's situation. Today we are facing situation because we do not have backup problem when a particular solution is created. So when you look at overall, if you look at the biomedical impact that COVID has brought, you can see that how the environment is getting polluted because of the practices, ignorant practices of the public, throwing used masks, or huge number of injections is left over because of the policy lapses of the hospitals and piling up of the waste. So at least at some places of India, we have to be prepared for third wave. This is for sure. This is going to happen. I'm not wishing. I wish that India come over this kind of problem and do not face this issue unless we, as citizens of India, each of us take steps towards mitigating or towards handling this waste in a proper manner. Otherwise, we have to face again challenge for the next wave. So how we can mitigate this one? So before that, I just want to shed a light over how corona and waste are interlinked with each other. If solid waste is not properly managed, then that can cause spread of the coronavirus. This is what said. In fact, some of the studies say that the coronavirus, which is reportedly derived from Chinese lab, might be one mistake of the mismanagement of the waste. It may be possible that while working on some virus, this coronavirus might have formed in such a way that that is not properly the sample that is where this coronavirus derived might not be disposed of properly, and that has led to the outspread of the disease. But this is only a kind of assumption. I'm not confirming that this is how it happened. Okay, let us leave that part and let us look at how biomedical waste is causing impact following corona pandemic, COVID pandemic. If you see in the March, this is last 2020 information taken from Times of India. In March, when there was no corona pandemic, you can see that almost 286 kilos of waste generated per day in Mumbai. Okay. In April 2020, when the onset of the corona started, it raised like anything, like COVID waste from hospitals has jumped significantly to several folds, from just 440 kilos per 440 kilos to 3,304 kilos, and that has gone dramatically up to July. This is the July 25th, 2020 data. So this is the one calculation how much COVID caused problem in India. And overall, if you look at total in India from June to September, the amount of waste that is accumulated has kept on increasing. Okay, I do not have statistics of the current year 2021 because the second wave has hampered our total research output. So I could not find any proper. So what should be done with regard to waste management? I mean, corona-derived waste means what kind of consequences it can cause, because it can easy transmission of coronavirus can happen if waste is not properly managed. Then segregation of the biomedical waste becomes huge problem, huge challenge for the health social workers. I mean, those. Then waste collection of the staff lacking PPE and lack of the training sanitary staff. Then vehicles carrying the MSW, municipal solid waste containing this COVID-19 becomes disinfecting becomes a huge problem. Every time it need to be reinfected, disinfected. And then the accumulation of biomedical waste like gloves, masks, sanitary napkins, all these can cause problem to health, public health. So there is an urgent need of separating municipal solid waste as well as the biomedical waste, as Professor Sadhan has already mentioned. I want to show small video on NDTV's report over current situation of the biomedical waste. Okay. Please confirm me whether video is visible or not. Whether video is visible?
Not visible, not visible. One second, you can click the.
You click
link.
that. You click that link. It's not taking.
Yeah, I already clicked, sir.
It's not taking.
It's not coming, sir.
Not coming. Even buffering also is not there.
Yes.
Okay.
I hope you can open another window, I think.
Now is it visible?
You can click the. Yes, yes.
Is it visible, sir?
Yes, yes. You can start from the from beginning. Voice is not audible.
So
yes.
Hope the video was
it is over.
Was played properly. Okay. Okay. Thank you. So this is one example. This is one small video that is showing the impact of biomedical waste. If we simply calculate how many numbers of injections may be released once complete vaccination program is done. We have 120 crore population, even 100 crore population are vaccinated, suppose. We have 200 crores of injections may be formed. Injections once because each time one injection must be dumped. So it will be a huge pile of plastic waste, biomedical waste. So what this huge accumulation of biomedical waste can cause? They can bring another kind of secondary infections which are not limited to corona virus, but we may have different other kind of pathogenic organisms can be outbroken, like you have different viral diseases, hepatitis B, hepatitis C, and different airborne diseases which can cause infectious hepatitis and Japanese encephalitis. Like this, these are some examples I have mentioned. And you have different kind of bacterial diseases. Bacterial diseases also we should be, I mean, because India being a tropical country, growing up of any pathogen is very easy in our environment. Unlike Western countries where you have a lot of cold weather, India is a tropical country. You have temperature that is suitable for the growing up of the organisms much easier, because you can see with regard to mucormycosis, this black fungus. I asked one of my friend who is in Germany, have you heard this post corona infection? Do you have there this black fungus? He said, no, we don't have this one. Because one thing is that there also you have diabetic patients. Here also we have diabetic patients. But the thing is that the climatic condition, which is most appropriate for bacteria as well as virus to cultivate themselves. Of course, virus do not need such kind of condition because they are non-living as per the biological literature. So how we should handle this huge amount of waste that is going up, coming up on daily basis post this pandemic condition. So as per CPCB, Central Pollution Control Board, Ministry of Environment and Forest, 1998, and amended several times in 2016 and 2019 also, as earlier Professor Sadhan has told. I have designed this outlines of how we should handle waste, whether it is hospital, whether it is institution, whether it is home, how we should basically handle this infectious waste collection from the source. Then at the source itself, we should segregate it. We should have at least 3 different types of bags we should have at home. One is blue color, green, and yellow. Yellow color is for the infectious waste. So once we segregate it properly, then disposal becomes treatment, and disposal becomes much easier. Otherwise, treatment for the same for all different types of waste becomes a great challenge. So here, a brief picture of different biomedical waste color coding is given for your reference. Suppose general waste is there, like kitchen waste and paper waste, all these can be green color bins can be used, whereas for the infected waste, infected plastics, plastic like syringes, gloves, and different plastic waste, you have red colored bins that should be used, whereas for the biological waste like laboratory waste or expired discarded medicines, one should use the yellow colored boxes. And for glassware, one can use the antibiotic vials or different kind of metallic implants. They can be thrown, discarded in blue color one. And whereas sharps, one has to use either black color or separate bins are there for the disposal of these sharps. And we have different kind of practices with respect to how safely dispose this biomedical waste, like autoclaving, which involves the steam sterilization at 121 degrees centigrade, and at high pressure, you have incineration, dry heat method at 800 degrees centigrade to 2000 degrees centigrade. These are the industrial practices that we have. And we also have chemical treatment, like 1% to 10% sodium hypochlorite.
Just a minute, Vijay Kumar garu. Slides are not presenting, only YouTube.
Oh, okay. I'm sorry. So slides are not present.
Yes, sir. Slides are not visible, sir.
After your YouTube link, slides are not coming. You can quit it.
Sorry.
You can close the YouTube. Okay.
Yeah. I was in impression that
Yeah, okay, no problem.
Presentation is going on. Now it started? It started?
No.
Yes, yes, okay.
Yes, sir. Please.
Continue, sir.
Means you didn't see this slide. Sorry.
You can go back, sir.
So the
Yes.
principles of
Yes, start.
biomedical waste management is derived from the principles made from the Government of India, Central Pollution Control Board, Ministry of Environment and Forest. WACs are different kind of WACs are there. This particular slide which I have prepared, taking the excerpts from biomedical waste principles of the Ministry of Environment and Forest, their publication. First, we have to collect the source, whether it is house or hospital, or mostly biomedical waste, infectious waste comes from hospital. So that's why I'm mentioned as the hospital. Otherwise, for any source, we should separate. The most important principle of waste management is the segregation. So segregation, once it is segregated, then we can decide on what kind of technique, what kind of the disposal method one can follow. That can be decided. So you can see that different kind of waste bins here, colored bins. I already explained. General waste to be kept in the green colored bins, and the infected plastic should be discarded in the red colored boxes, and then infected waste, biological waste should be kept in the yellow, and then glassware, metals should be in the blue colored bins, and sharps can be kept in the black bins, double layered black bins, or maybe in the separate containers. And they have different kind of disposal methods, like you have landfilling, secured way of landfilling, both incineration, then followed by the landfilling, then autoclaving in case of the infected waste as well as the infected plastics. Plasma pyrolysis can be done at high temperature. Then autoclaving also can be done. So I will discuss each technique separately, so students will have a more clear idea what is what. Many students may not be knowing what is autoclaving. Being microbiologist from the science background, I know what is autoclaving, but there may be many students. So for their benefit, I want to mention that autoclaving is a steam sterilization method using steam, the way you use pressure cooker at your home to cook dal, papu. In the same way, one can autoclave so that you can kill all pathogens at 120 degree centigrade at high pressure, 15 psi for 30 minutes. Then incineration is the dry heat method, which uses almost 800 to 2000 degrees centigrade. It is in order to liquidate metals, one can apply this incineration method. I have shown pictures also here. Incineration involves like this dry burning, whereas autoclaving involves this kind of chamber and chemical treatment. We all know that government is supplying sodium hypochlorite to those homes, to those residences which are suffering from the coronavirus infection. You also may be knowing that 3% hydrogen peroxide as well as the chlorine bleach, they are also more popular kind of disinfecting biomedical waste, whether it is home or at hospital or healthcare facilities anywhere. And apart from that, some advanced technique like microwave, also the radiation, which use the radiation. This is the industrial autoclave machine. You can see huge number of huge amount of waste can be autoclaved by putting it inside, then closing this lid because and pressure is created. So that's why a very tight. This is the industrial autoclaving machine. This is one example. So what kind of method we should follow? How to select which type of waste should be treated in what way? So as per WHO manual, you have at least 10 different categories of waste are there, and each waste should be treated in one manner. Suppose more important category is the category number 1, human anatomical waste, that is human organ. This is exclusively comes from the clinical labs or hospitals. It should be incinerated or burned. And then animal waste, also incineration. Microbiological or biotechnological waste, which comes under category number 3 from the diagnostic labs, it should be local autoclaving, then or maybe incinerating. Then you have sharps. Waste sharps are there. They should be treated by microwaving and then followed by shredding, that is cutting into small pieces. Then you have the category number 5, discarded medicine. Somebody asked how to cytotoxic drugs, how they should be discarded. So that should be incinerated again. and then that can be kept in the landfills. Then you have soil waste incineration. So like this, you have variety of methods, variety of waste, and you have specified techniques for each kind of the waste, specified technique of the handling waste you have for the each kind of the waste. So so well said. We have discussed so much that how different waste can be treated. How if we do not treat the waste, the question is that if we do not treat the waste, what is going to happen? So I just want to briefly give glimpses of impact of the waste on our environment. So I just want to have one more video. Oh, sorry. How waste has impact on our environment.
Yes, yes.
So I think briefly that is enough. That that is causing effect on our environment, and the important step that we can take is segregate biomedical waste from regular waste, kitchen waste or household waste. So sir, screen is visible. Sir, screen is visible.
Yes, yes, visible,
Yes,
visible.
yes.
Sir, visible, sir.
Yeah. In this regard, how our nations should work, how our nations should treat our environment. One student, school-going student from Sweden, Greta Thunberg, she has given one wonderful quotation that I don't want you to be act during the panic. You should feel like your house is actually on fire, because it is actually on fire. We are not feeling, we are not sensing the severity of the problem. So this small student, this student from the Sweden is global figure now, because of her campaign towards a safe environment. So you can just Google about her activities, and you can see that Fridays are for future. She started one global campaign of Fridays are for future, not for studies. Let us save our future and dedicate a day on Friday for saving our nations. So so what happens if we neglect this biomedical waste segregation or treatment, right treatment? What will happen? That the immediate impact is that it can cause a kind of feeling of nausea, indigestion, feeling of unhealthiness, vomits and different kind of mental psychological issues. So imbalance, it can come, as well as in long term, we may see new types of diseases. Today we had corona, tomorrow we may hear some other kind of disease. So they can interact with our genes, as I already told, and can cause different kind of cytotoxicity. Also, this toxin accumulates over the pyramid of food pyramid, and then it can accumulate. It can go into all organisms. Then a chemical poison can cause a different problem. Genetic anomalies you can get, and low birth weight, congenital malformations, as well as cancer, shortening of lifespan, early death, hospitalizations. So all these are the impacts on human health. But if you look impact on environment, you can see that already Sir has told that groundwater pollution, groundwater becomes a huge problem for us. Then it can cause infection both in animals as well as humans. Today we are discussing about coronavirus being infected in the humans, suppose. But when SARS virus came, when bird flu came, then so many birds were killed. So nobody bothers to kill animals, but human life is precious, because on our earth we have only two species. One is human, the other one is human's pet. All other animals were kept into human's pet. Somebody said this one. And then all these can cause economic imbalance and then poverty. So what is the approach? What approach we should follow? For any waste, whether it is biomedical waste or solid waste, the approach is 3R principle. That is, reduce the waste. That is, try to use the material. Suppose let it be mask or let it be anything, biomedical waste or anything. Try to reduce the usage so that waste do not come. When this is not possible, try to reuse. That is, suppose you have the mask made up of cloth. Instead of throwing it, just try to reuse 3 or 4 times at least. Now, I'm not saying the number, but reuse, that is the one principle. Either reduce, reuse, or then recycle. So prevention, you can see that when prevention, from the most favored option is the prevention, that is reduce, then minimization. If not, then reuse and recycle. If these 3 are not possible, then at least try to derive energy. Then also, if not possible, then dispose it. So 3R principle is the most common, most important principle that we should all adapt. And I think policymakers know this one. Still, I want to, based on this discussion, today's discussion, I framed certain points which may be conveyed to the government of, that is, applying 3R principle is the most important, challenging, important one. And then right use of the color-coded waste collection bins in order to segregate it properly. Then isolating infectious waste from the normal waste. Then using double-layered bags for the shops, because sharp waste is going to increase so much. In order to avoid the spillage, also we should use the double-layered bins, collection bins. Then proper signage board should be there, that this is the place where masks should be thrown. This is the place where gloves should be thrown. Like this, there should be proper signage should be there. So the lack of signage causes the problem. Then training sessions for the way we are conducting seminar, in the same way, training session should be held for the sanitation workers and healthcare workers. Public awareness campaign should be conducted on the biomedical waste, as well as above all this, we should have the self-hygiene practices, that we should have the basic feeling, the civic nature, the way Mahatma Gandhi said, when we have inner and outer cleanliness, that leads to godliness. In the same way, that is the best policy that we can have. Some recycled products after COVID, out of the COVID plastic, the plastics that are derived during the COVID, these are the some materials which are derived from the plastic after the COVID pandemic. These are in South Korea. Some company is preparing like these stools for the chairs for the schools, so kids can safely use that one. Just I want to show one recycle story with that today's discussion will be finished. Sir, whether screen is visible?
Yes, yes, coming. Video is coming. Streaming.
Yes, sir. So net is slow. This is the last slide. This is the slide, sir.
Okay, just a bit.
These are made from mask, exclusively from mask. See, mask is being kept here. Just the slide
Okay.
is visible.
Yes, it's visible.
Okay. So this is the lesson that whether we reduce or we reuse or we recycle in the way in the video it was shown. Even our government, our policy makers, as well as our youth, our students, first of all, should try to explore what we can do out of biomedical waste after proper treatment, after chemically or after treating in a proper manner, the way I have shown different steps. Once it is properly treated, then how it can be reused. Well, it is the high time that we should explore scientific methods of reusing biomedical waste in a proper, sensible manner. Otherwise, there is no end to this. So I attribute all these to material from Biomedical Waste Management Act 1998, 2000, as well as the WHO Manual on Biomedical Waste and Asian Development Bank Manual on Hospital Waste Management. I give credit to these. So with that, I would like to thank all of you for your kind patience. And I want to give one quote that everybody start thinking that what I can do, what I can do. I want to just mention one Mother Teresa. Today, if Mother Teresa is there, she might have saved the lives of millions of people, definitely. Those young generation who do not know, I think, sir, many of us know that if everybody thinks what I can do, then I cannot make the change. Okay, I alone may be small ripple in the ocean but together we can create impact. So once again, I suggest students and youth to join in mitigation of biomedical waste as well as create health and safe environment. Thank you.
So thank you very much, Vijay Kumar Garu, for a nice lecture.
Thank you, sir.
And
presentation still
you can just
stop sharing.
Vijay Kumar Garu.
I want to stop sharing.
You just stop sharing. Yes.
Thank you.
So there is this thing, because for recycle, reduce, these are the words I am hearing for the last 30 years. Say, if we want to have a dinner or lunch from a hotel, earlier we used to make a slot for it and we used to go there and bring. We were stopping the work at home. So nowadays, a facility has come that you can order by a phone and they will bring you, they will serve you. And similarly, the one problem for this waste management is for recycling and reduce is that it is a small individual, each individual has his own this one, and the collection becomes a major problem. So if somebody, an unemployed man takes this and appoints a few collection agents in different areas and pull up that waste what is generated, particularly in this time of this COVID waste, it can be recycled, and you can, as rightly Professor Ghosh pointed out, so it can be converted into a business. So why should if for example, if Vijay Kumar said, why should I listen? See, among these ego problems are among the individuals. But if you say that if you do this, you will get this much money. Say, I tell you one example, Ramki. There is an institution named Ramki. So wherever you go in Tamil Nadu, Andhra Pradesh, Telangana, all the industrial wastes are handled by them only. All TSDFs are maintained by them only. Say all plants put together, few thousands of crores are there. Their properties are their maintenance costs and all. From among the 15,000 crores, what I heard, he has a THDF facility in Pune. So this is the volume of money present in that. If somebody rightly comes from it and want to materialize it, people are ready to accept. If somebody wants to take the waste from my house, yes, every day I am ready to pay 2 to 3 rupees. If you make it 500 houses in a colony, so you just go multiply with it, and you can employ some people also at the same time. And that means it is what is called a sustainable model. It is a sustainable model. So that encourages the waste to be brought to use. So that is how this waste can be managed. Simply, these are not scientific mechanisms or phenomena. So recycle, who will recycle? You have to collect all this. There someone who is collecting all the newspapers, waste papers, making it bales, sending to the fresh newsprint offices, manufacturers. So like that, for everything, there should be an entrepreneur to take up this. So he will be suitably paid. He will get a suitable, returns. So just now I told you the industrial wastes are handled at thousands of crores per annum. So you make a one fraction out of it. You make about 1 crore from it per year. So your profit will be not less than 20 lakhs or a gazetted officer. Like that, this kind of the potential what Sadhan Ghosh has been emphasizing. So the young entrepreneurs can be encouraged by for these three: reduce, recycle, and reuse. So this has thousands of crores of money. So you imagine the services provided by the Swiggy and all people just bringing them food for us. Like that, you make a mechanism to collect all this. So send it for recycling and then send it for market. Prepare articles and then 4-stage marketing is possible with this. So dear friends, I congratulate.
I can take some questions.
Yes.
Yes, Vijay Kumar Garu, just one question from me.
I think. Please, sir.
Okay, during COVID-19, this formula is not feasible. Reduce or reuse or recycle.
Sir,
only dispose.
Only dispose and only dispose. Okay, during the dispose, actually the material which you have used, cloth as well as some plastic and some surgical material. And only sneezing is coming out.
Aruna?
Sneezing. Due to sneezing, liquid droplets are found into the
even
mask.
while talking also.
While talking also.
We talk also, droplets comes. We need to sneeze or we need to cough. Even talking enough, sir.
Yes. Okay. Sneezing droplets are form on the masks.
Yes.
What is the how much time they are supposed to be giving a infectious to the other organisms, not only human. We are thrown into the dustbins and also the municipal solid waste we are sending. But these are giving any hazardous to the dump yards, the municipal solid dump yards are nearer to the community bins. It may be give any hazardous to the other environment as well as the other organisms, not human beings, because humans are aware we are not supposed to be reused.
Yes, sir. We might have heard in the
microbiological aspect. You can give some.
Yes, sir. Generally speaking, these zoonotic infections means the bacteria or virus which cause infection to humans is different from those which cause disease to the animals. Yes, sometimes animals may become as reservoir for causing infection to the human. This happens, but most I never heard some disease which has gone from human to animal. There may be definitely there is possibility. Definitely may be there. It may be possible that I am lack of the knowledge, but most of the time what happens is that a disease comes from animal to human, because humans are more susceptible when compared to animals, because we are not in direct link with nature as much as animals have. Also, one physiological difference is there, sir. Animals their body temperature is different from human body temperature. We have constant body temperature of 37 degrees centigrade, but birds as well as other animals, cattle, and they have flexible variable body temperature where bacteria and virus do not survive. So that is one of the major difference between humans and animal disease. So there will not be any problem even if we leave, I mean, unattended mask, if suppose a pet dog comes off our home and if it touches, our pet dog do not get any harm.
Okay, okay. There are so many WhatsApps.
No problem.
Dogs are also getting COVID. That's why they are careful.
But that
nice.
do not spread so easily, sir.
Yes, yes, yes.
I think in the chat box there are some questions.
Yes, yes, there are some. James is asking questions.
I try my best so that I can improve my knowledge. Wow.
Okay, okay, okay. James. James Hillary is supposed to ask some questions in the chat box. James Hillary present?
Thank you, sir.
Yes, yes.
Good afternoon, sir. Thank you
Good
for the lecture. It is very useful and informative. So here are some questions from participants. And the first question is, what is the duration of storage of biomedical waste in hospitals before disposal?
It should be thrown. It should be disposed of within few hours. But I'm not exactly sure. But maximum incubation time for bacterial infection or viral infection is 8 hours, because within 8 hours their replication cycle starts. Bacteria or virus, if you see, their numbers again increase within 8 hours after time. So when we keep at low temperature, at ambient, condition, then maximum 8 hours should be kept. After that, it should be disposed of.
Thank you, sir.
Although
and
I may not be precisely correct, but biologically this is the relevant answer. Yeah.
Okay, sir. And the other question is, among all the disposal techniques, which is more eco-friendly? This is question asked from Rupa Sravanti, student of
This is actually very difficult to answer. Most eco-friendly, because any waste treatment practice will generate some or other kind of problem. In fact, my research involves, I am doing research on how to use microorganisms in order to effectively degrade plastics, so that plastic get liquefied and so that it can be easily disposed of. Within biomedical waste, I can say that most eco-friendly is autoclaving. Autoclaving is one of the suitable technique than when compared to other kind of techniques. But even autoclaving will result waste which should be landfilled. So frankly speaking, there is no absolutely fine eco-friendly disposal method. So far not invented properly. Maybe Professor Sadan Kumar sir, because I'm quite young, so with your experience, if you can shed some light over this question, I will be very happy.
Oh, wow, I was not hearing. What is the question?
What is the among all the available techniques, which is the most eco-friendly way of the disposal of biomedical waste?
Okay, so most eco-friendly biomedical waste treatment, what we have said, that the first thing, first treatment, before treatment, segregation is the first requirement. If you don't segregate, then no treatment. Just go to the landfill, secured landfill. But segregate, and if you segregate that accordingly, you can go for the treatment facilities, and you have to disinfect, and that's why autoclave is necessary. And if you go for other infectious things, then you cannot go for any other recycling, but you incinerate. So, and incineration, only one thing, in some of the plants, this incineration, there is a heat which is produced from the heat we are giving. So in that way, if any plant takes out that particular heat as a recovery, and then it is circulated for other use, then it is always better, and that is an effective treatment process. Otherwise, whatever treatment process has been discussed, that is the best treatment process available throughout the world today. And then the recycling. Okay, thank you.
Correct.
Okay.
James,
Thank you, sir.
you are from South India?
Yes, easy. She is my student, sir.
Oh, but your name
Yeah, first.
like that you have come from Hillary's country.
Yes.
Good. Yeah.
And one more question.
Yeah, please.
How should an individual at home dispose biomedical waste? Are there any precautions to be taken?
See, one can use sodium hypochlorite, 1% sodium hypochlorite to sprinkle over the, suppose you have mask, used mask or used bandage is there, 1% sodium hypochlorite can be sprayed, or 3% hydrogen peroxide can be done. If these two are not available, at least take a yellow colored bag and safely dispose it off. So government will take charge of that one. So that is the best way can be done at our home.
Okay, sir. And the last question is, are there any special techniques to dispose biomedical waste that India is not following yet, but the other countries are following or using?
I think microwaving is the technique. I'm not sure whether how far India is using the power of radiation in order to reduce the waste. Maybe once again, I take excuse of Sadhan Kumar sir to explain this one.
Yeah, what is that? Radiation.
Which technique that India is not following, but other developed countries are following in disposing of the biomedical waste.
Look, only one thing that many of the countries are using the plasma technology, right?
Okay.
So that is only a separate part. Otherwise, this is more or less same throughout
Absolutely.
the world.
Absolutely.
There is no, I mean, you know that first thing is that only what I was telling, that energy recovery is the best part out of the incineration or the pyrolysis, I mean, or the
Exactly.
plasma. Otherwise, you have to go for autoclaving. Now, autoclaving, the system which we are following for the autoclaving, maybe there is an improved autoclaving process. But disinfection by autoclaving, autoclaving is a principle, right? Then the process is developed. So that way, if any country or any specific country, like what Vijay was telling, that micro or other,
Microwave.
if they are doing any specific technology, unless and otherwise they're interested to sell that technology, they don't expose that technology also.
Exactly.
Right.
Yes,
So
sir.
that's the thing.
Okay, right. Thank you.
Thank you so much, sir.
Thank you so much, sir.
Thank you, Sadhan Kumar,
Sir,
sir.
from participants, there is a request that would you like to please share that PPT, like link or
Who wants that? Who wants that?
Vijay Kumar sir.
Could you write in chat box that I want the PPT? If
Who wants
somebody says I want
can
the PPT, my next question will be, what you will do with this PPT?
It's like they want to know more.
Best thing is that
They want information or they want PPT?
No, I'll tell you. That's why I asked at the very beginning, Dr. Brahmaji and Professor Swami, I got my answer that this will be recorded and this will be given in the YouTube or any other link will be given. So that is
Yes, sir. Yes, sir.
you guys.
Yes, sir.
Because not only you will get PPT, you will also get the explanation by the speakers. So that will be really helpful. And the third question is, using others' PPT does not help you in developing your knowledge. So if you want to make any PPT, study, make your own PPT and present it. That will definitely help you in future. So that's why I usually don't share the PPT. Thank you.
Yes, sir. Yes, sir.
Yes, yes.
Okay, that is good.
Thank you,
Yes,
sir.
yes. Yes.
Thank you. Okay.
So we had a very nice session and a question answer session.
Truly.
And the participants are also about crossed 700.
Good.
Both YouTube and this one. And now I request our Shashidhar to just present the token of appreciations to Professor K. Sadhan Ghosh, So it is shared in the PPT. So this is the one we are presenting to our, with great respects to the resource persons. So generally, it is very difficult. Sadhan goes for 2-3 hours. 2-3 hours. So that is, and the other one, Professor Vijay Kumar. Vijay Kumar also, he has roots in Andhra University.
Yes, sir. I am from Guntur actually.
Now delivering fruits to Delhi.
Thank you.
So we had very nice sessions to you, and this is the small appreciation.
And it is my great opportunity that this venue gave me to meet with Professor Sadhan Kumar sir, Swami sir, and Brahmaji Rao sir. I'm really because being a youngster, I mean, you can understand that your guidance and your deliberation will help me in long term.
Okay, thank you.
Thank you. I like your presentation.
Thank you, sir.
Thank you.
Thank you so much.
So thank you, and these certificates will be mailed to you, sir. And now I request our friend from the World Environmental Organization from Telangana, to present a formal vote of thanks. Veerbhadram. So Veerbhadram is not there.
Dr. Bhadra?
Bhadra.
Somebody better call him.
So Shashi, call him.
Hello. Sir, he is online.
Yeah.
Yes, sir.
Yeah.
Sir, good afternoon, everyone.
Yes.
Especially thanks to everybody, all the participants, especially today program organizing and organizers. My special thanks to Department of Environment Sciences and Acharya Nagarjuna University. I am one of the old student in our department. Especially today program technical supporters, Dr. S. Raju sir, Principal, Nunna Physical Education College of Physical Education, Nunna, Vijayawada, and yes, Sarboji Rao Garu, Principal of Aditya College of Group Engineering and Colleges from Kakinada, and our Honorable University, Acharya Nagarjuna University, VC, Sri Professor Rashekar Sir, and Rector, Professor Varaprasad Murthy Sir, Registrar and Science College Principal, K. Roshaya Sir, and today program, especially our department, completely pandemic situation, useful and truthful and informative information. All the section organizers from our department, HOD, Dr. A.V. Swami sir, and Dr. Brahmaji Rao sir, and CEEED founder and director, K. Sesidhar sir. Special thanks to our Department of Environment Science, Madam Neelofer, and technical team, her students, and especially thanks to Mylavaram College of Engineering Principal sir, and Green Club volunteers and Green Club all organizers, especially today keynote speakers and resource persons, Professor Sadhana Ghosh sir. Especially I tell one Telugu word, you are the walking university, sir. You have a lot of knowledge, you have a lot of information, especially upcoming young generations, students, you are the best resource person, you are the one of the knowledge ocean in India, my expectation, my thinking, my opinion, sir. And another resource person from Delhi, especially our Telugu state, Gunturu, near to our university, he is settled in New Delhi. Dr. K. Vijay Kumar, he is the one of the youngest and research fellow in Government of India scholar. I especially thanks to all the participants, maximum 29 states students and different sectors, education sectors, and research scholars and other hospitals delegates, different maximum 29 states registered in our webinar, national webinar, maximum 29 states and 2 Kendra Palta Prantas, 2 maximum above cross the registration forms. Especially thanks to all the participants and all the delegates and dignitaries, and my sincere thanks to given by this opportunity, Department of Environment Sciences. Once again, save nature, save future. Let us unite, protect our environment. Once again, we are planned for another seminars, especially pandemic situation, environmental impacts, and other global issues, and present situation, how to protect our individual health and environment. First word use Dr. Vijay Kumar sir, man, Corona killed the man, but man killed the nature. Excellent word, sir. Present situation, enter the world population, maximum 700 population, 700 CR population in the world in living. But present situation, man made and mankind use all the biomedical waste, no process and segregation and scientific reasons how to dispose, how to segregation, how to separation is the different persons, different variations. But Sadhan Ghosh sir Sadhan Ghosh sir already told how to use the segregation, separation, how to dispose, how to dump. Especially our university near spot, Mangalagiri, one of the best spot, especially for students and research scholars use the biomedical waste spot. My sincere thanks and one and all the participants, upcoming seminars and upcoming schedules, all the program schedule. Please, we need all the participants support, especially today program very grand success. My special thanks one and all. Once again, today program 2 resource persons, 2 real heroes today join, make a grand success. Sadhan Ghosh sir and Vijay Kumar sir. My special thanks to thank you given by this opportunity one and all.
So thank you, Veerbhadram garu. To all the participants, say pranams from all organizers for your patient listening, and you have not created any disturbance during the sessions and all. And I am to inform you that now the feedback form will be placed in the chat box, and check your mail before you post it, because that will go to your your mail. If any mistake is there, it cannot generate this for the second time. So by evening, by 8 o'clock, all will get the certificates. So don't worry, you need not put any messages for this. So I once again thank you to all the resource persons, participants, and the technical support staff, particularly being the principal also our helped in conducting this webinar. Dr. Raju is there. So all these, they continuously they are helping. Last year we organized 7 seminars, and this year also this is the 3rd one. So they are continuously extending the technical support. Thank you very much. Thank you all.
Thank you.
Thank you.
Thank you, one and all.
Thank you. Thank you.
So I believe we can leave now.
Yes, sir.
Yes, sir.
So thank you.
Thank
you
you,
very
sir.
much.
Thank you, Sadhan sir.
Bye.
Thank you, Sadhan sir. I will email you.
Sure.
I will email you, sir.
Please.
Okay.
My email I have already given in the chat box.
Yes.
And all others, so you can take it.
Okay, Vijay Kumar, be in touch with him. He is a very good resource person.
Thank you, Swami sir. Thank you so much.
Okay, all the participants also.
వచ్చినప్పుడు కలుస్తాను.
తప్పకుండా రండి గుంటూరు వచ్చినప్పుడు. Okay.
Thanks to Bhadra WEO for bringing all of us onto one platform, sir. This is the real Prakruthi as well as WEO. We should all motivate and encourage them to conduct such kind of seminars more and more. You have one brilliant and excellent student, Bhadra. I think we wish him all the best in his future endeavor for better, safe environment and creating the green planet. That's what his dream. So let us wish him all the best, sir.
Yes, yes.
Yep. Bhadra, thank you so much. So can we take leave, sir? No?
Yes, yes, yes.
Thank you, sir.
Yes, yes.
Thank you, Brahmaji Rao, sir.
Thank you, Vijay Kumar.
Yes, Kanna. కాకినాడ ఆదిత్య ఇంజనీరింగ్ కాలేజీలో ఫిజికల్ డైరెక్టర్. ఆయన మనకి హెల్ప్ చేస్తుంటాడు, మంచి ఎక్స్పర్ట్. ఎక్కడ ఏమి డిస్టర్బెన్స్ రాకుండా కూర్చునే ఉంటాడు. రాజు అంటే ఇక్కడ నొన్నలో ఒక ఇంజనీరింగ్ ఈ కాలేజీ ఫిజికల్ ఎడ్యుకేషన్ కాలేజ్. ఇంతకుముందు మా సైన్స్ కాలేజీలో చేసాడులే.
Hello. I request all the participants, please note, already we are posted the feedback form in the chat box. Please, all the participants fill that feedback form and get your participation certificate through the mail ID. Thank you.